It was my understanding that another member from the Democrat Party was going to speak at this time, but not seeing him, I think I will just go ahead and deliver my presentation. Mr. President, as a candidate for the Senate during this past year, I met with many Hoosier families, small business owners, as well as healthcare providers, patients, doctors, those involved with concerns about where this healthcare process was going to go. Everywhere I went, from Lake County to Fort Wayne to Indianapolis, Muncie, Evansville, all across the state, I heard a resounding plea to overturn the costly and intrusive healthcare law that was passed by this last Congress and signed into law by the President. Mr. President, the issue for these people was not whether or not we needed to address issues of healthcare, whether it was quality, cost, effectiveness, access. The issue for them were two things. One, they resented the process, which forced through a bill which many did not fully understand or grasp the implications of, which was enacted and passed here in these chambers literally hours before Christmas. Rather than the rules were bent to try to move this through the process, and it became a policy which was not supported on a bipartisan basis, but yet a policy that affected virtually every American. And the experience tells us anything. It is that massive changes in policy need bipartisan support to be acceptable if they're going to be effective. The agreement was, therefore, among the majority of people that I talked to, that the health care plan that is now in place is fatally flawed and needs to be repealed so that we can start over with a much more cost-effective, efficient, affordable health care plan. Those who have listened to the people, expressed their views on this particular issue, have come to the conclusion that their voices were not heard, as they expressed throughout the deliberation of this, that Congress wasn't hearing what they were saying. The results of November, I think, with this issue being central to the election, ratified that. And so I urge my colleagues here in the Senate to listen to the American people and repeal the law that's before us, a health care law that raises taxes, penalizes businesses, straps states with costly mandates, and increases premiums for American families. Recent polls show a significant majority of Americans want the President's health care law to be repealed, and they want Congress to start over and put together a plan which doesn't eliminate every part and parcel of the law that passed. There are some good provisions in there, but overall, the provisions add up to a flawed policy that will cost the taxpayer a lot of money and will not provide the access and the care and the quality that Americans are looking for. We know that more than half the states, including my state of Indiana, have joined in lawsuits challenging provisions of the constitutionality of the law. That will be settled by the Supreme Court in due time. But I believe we must take this opportunity now to overturn the law and start over. Let me just address some of the consequences to my state of Indiana and to Hoosiers if we do not repeal the current health care law. Hoosier families will clearly face higher premiums. The nonpartisan budget experts from the Congressional Budget Office reported that individual health insurance premiums will increase by $2,100 per family as a result of this new law. If we do not repeal the health care law, 50,000 low-income Hoosiers will be dropped from the Healthy Indiana plan. This was a plan implemented by our governor and our state representatives and senators, an innovative plan that addressed a real problem of low-income Hoosiers not qualifying for other support. This plan put in place a proposal for health savings accounts. The program has been so popular that it now includes more than 50,000 participants. Unfortunately, as a result of the health care law, the state will need to terminate the Healthy Indiana plan and place its participants into Medicaid. This is just one example of a provision of law enacted at a federal level that denies units of government, states, localities, and others, from innovating and bringing about sensible, market-based solutions to programs that they face and needs that they need to address. But as I said, unfortunately, the one-size-fits-all federal law basically says to those states and those innovators, no, we know better, we'll tell you what to do, regardless of what the cost is or regardless of how effective your program is. Our governor had negotiated a savings of $400 million over a 10-year period of time in prescription drugs for low-income recipients. That plan has to be overturned. It is overturned by this law and no longer will be in effect, therefore costing not only the state the savings that are lost in this, but also the recipients of the prescription drugs. If we do not repeal the health care law, Hoosier taxpayers will bear a heavy burden. The law will force Indiana to expand Medicaid, enrolling approximately 1 in every 4 citizens in the program. According to an actuarial analysis by the Indianapolis-based Milliman Inc., a nonprofit, nonpartisan group, Indiana will have to absorb an estimated $3.6 billion in new costs over the next decade if the 1.5 million eligible Hoosiers enroll in Medicaid, which they would under this plan. That burden is passed on to Hoosier taxpayers, and our state, frankly, cannot afford to do that. The report also predicts that Indiana would have to spend more than $300 million on new administrative costs alone. So with states already facing budget cuts, there's no doubt that these costs will either be passed on to taxpayers or the state will opt out of the plan and turn the people over to the exchanges and to the control of the federal government. If we don't repeal the health care law, Hoosiers will see a decrease in the quality of service of care. I met with physicians, health care providers, hospital administrators at sites all across the state. I heard a very common concern. The new law will jeopardize the quality of care for patients. Health care plan cuts reimbursement dollars for hospitals and providers at a time when they can least afford it. These cuts simply exacerbate the dire shortage of doctors and nurses and will result in less advanced care for people in need, less personal attention from providers, and fewer choices for patients. If we do not repeal the health care law, Hoosier businesses will suffer. The President's health care overhaul hits our job creators with harmful mandates and regulations, mountains of paperwork, and countless taxes. The new law requires businesses with 50 or more people on staff to pay a $2,000 tax per worker if the employer does not offer an acceptable health insurance plan for its employees. Mr. President, if I heard one thing more than any other thing from business owners, it was that this law will drive them to make employment decisions that are adverse to the benefit of those seeking employment. Companies that were in the 45 to 50 range of employees, or even less, have basically said, if the choice comes to whether to hire new employees or whether to outsource, whether to use technology to replace those employees, if I have to go over 50, I will do that rather than hire new employees. It's just an arbitrary line drawn at 50 basically puts the job creators of this country, the small and medium-sized businesses, in a position of having to decide whether to take on the mandated tax burden of the federal government or whether or not they will, or simply not go forward and hire over that particular limit and find other ways to produce their product without added employment. At a time when we are facing 9+, nearly 10% in many areas, unemployment, putting a law in place on a nationwide basis that discourages businesses from hiring is simply the wrong thing to do. Other businesses may find it more cost-effective, and many have told me they would, to drop workers from their health insurance plans and pay the fine instead. Turtle Top, which is a shuttle bus maker located in New Paris, Indiana, found that dropping health care coverage for employees and paying the federal penalty would generate a savings in the 6-figure range for the company. That is a story repeated over and over and over, The law dictates a financial benefit to the company to drop their insurance plans and shift the coverage for employees over to the federal taxpayer. In fact, the administration's own estimates revealed that the more than 6,000 pages of regulations mandated by the law could force half of all employers, as many as 80% of small businesses, to give up their current health care coverage within the next 2 years. Now, one burdensome regulation is the 1099 provision. I believe we're going to have a vote on that amendment, and I hope that it passes. This is one of the many egregious, unexpected consequences of pushing a law through without fully understanding the law and the implications of the law. And rather than begin a piecemeal approach to deconstructing this 2,100-page or more bill, I believe it's expeditious for us to repeal and start over. The medical device tax particularly impacts my state. It adds a 2.3% sales tax on medical devices. This is an industry in the state of Indiana that probably is one of our top manufacturers, making a profit, hiring people, and yet arbitrarily taxed as a way of helping to pay for the costs of the health care bill. Cook Medical, a medical device company in Bloomington, expects the new health care law will cost the company $15 to $20 million per year. And this is a company, along with Biomet, Zimmer, and many other medical device companies, that simply had the deep pockets because they were producing products that the world wanted to buy. They were one of our export leaders, and because they were making profits at a time when the federal government was looking for money to pay for other aspects of the health care plan, they simply added a 2.3% sales tax on their devices, a total of about $20 billion. The health care law devastates Indiana businesses. 1 out of every 10 individuals today in Indiana is looking for a job, and Congress should be focused on ways of encouraging those individuals and encouraging private sector growth and job creation, not stifle it. Our health care system in America has problems, but restructuring it with a one-size-fits-all government-run plan that increases taxes, raises premiums, and hits businesses with penalties is not the right fix. Congress needs to repeal the current law and start over by a step-by-step approach that reduces the skyrocketing costs of care. Now, listening to Hoosiers over this past year, I created a list of 10 priorities that Congress, I believe, should focus on when we do start over. 1, allow competition across state lines. We need to improve access and the quality of care by increasing competition and allowing consumers to purchase health insurance across state lines. Encourage innovation, and I talked about the innovation that's taken away from our state through this law. Eliminate frivolous lawsuits and include liability reform. How this bill could have passed without liability reform as a part of it, when all of us know that defensive medicine is forced upon doctors and providers and hospitals through frivolous lawsuits without a sensible process of providing for those who clearly are victims of malpractice, but taking away the egregious steps that have been taken and egregious awards that have been made for honest mistakes. Without that being a part of the health care bill, it undermined the credibility of what Congress was trying to do and what the American people and health care providers were looking for. Improving Medicaid and the S-CHIP program, allowing for the immediate creation of association plans for small businesses, incentivizing and rewarding healthy lifestyles, expanding health savings accounts, not reducing them, advancing the use of electronic medical records, increasing cost transparency, and retaining our promises to our military personnel, veterans, and their eligible family members are all components of the more detailed plan that I outlined this past year in Indiana. Most importantly, I believe the underlying principles to ensure our health care system is one that preserves personal freedoms and puts individual control of their own health care decisions is critical to addressing the next bill that we take up. So let's take this opportunity now. Let's listen to the patients. Let's listen to the health care providers and physicians. Let's listen to the job creators and small business owners And then let's listen to the American people who sent us here to represent them. Let's repeal this law and let's start over. Mr. President, I yield the floor.
Mr. President.
The senator from Florida is recognized.
Thank you, Mr. President.